morning. Today's topic will be on health, and especially what we are going to talk about is what are the various changing concepts of health and what are the various changing concepts of public health. Usually, it will be a important 5 more question for your university exams for the undergraduate as well as for the postgraduate students. So, I am Dr. M. RajMohan, Associate Professor from the Department of Public Health Industry, SRM College and Hospital, Chennai. So these will be the topics under which we are going to see. Coming to the introduction, as you know, the oldest definition will be what is health? It's the absence of disease. And according to WHO, they have given that all the citizens of the world by the year of 2000, now it has been extended to the level of health that will permit them to lead a socially and economically productive life and should be for health for all. This is the concept which is provided by WHO. Actually, first it was proposed to be till the year 2000, then it is now extended till 2030. So, coming to the common definition which you are going to, that is soundness of the body or mind, the condition in which the functions are duly and efficiently discharged. This is another definition given by Oxford English Dictionary. So, this is the definition you are going to see and how it plays an important role. So coming to the various changing concepts of health. So there will be four changing concepts of health and four changing concepts of public health. So first starting with changing concepts of health. So first is biomedical concept. So from the early days it has been viewed as what is health. So any absence of disease, it is essential to be the person is healthy. So you know that the germ theory of disease, which was dominating the medical field during the 20th century, germ theory which was proposed at and by Louis Pasteur. So what it is like, what the biomedical concept says is the medical profession says that the human body is like a machine, and disease is like a breakdown of the machine. So human body is almost or part similar to that of a machine, and the disease is to be as breakdown of the machine. So this concept was successful. They treated diseases, but inadequate some of the major health problems like malnutrition, chronic diseases, accidents, drug abuse, mental illness, environmental pollution, and population explosion. So these problems are discussed or not solved with the concept of this biomedical concept. So comes ecological concept. Eco, eco is environment. So health is a dynamic equilibrium between a man and his surrounding environment. So not only it should be the absence of a disease, also from a equilibrium between a man and his surrounding environment. So the person who is a very pioneer in the field of that ecological is Dubos. He says that health implies the relative absence of pain and discomfort to ensure a optimal function. So both the human, ecological and the cultural adaptations determine not only the occurrence of a disease but also the availability of food and the population explosion. Next one, that is psychosocial concept. So development in social science revealed that health is not only a biomedical phenomenon, like not the absence of a disease, but also it is influenced by the social, psychosocial, cultural, economic, and political factors of the people wherever they are concerned. So everything social, psychosocial, cultural, economic, and the political factors where the person is going to be there, it is going to be a concern for them. So these factors should be taken into the consideration in defining, also in measuring the health. So not only the absence of disease, but also these various factors is going to be playing this healthy individual. So that is psychosocial concept. So according to this, health is both a biological as well as a social phenomenon. Coming to the last one, that is holistic concept. Holistic, as you know, it encompasses everything. So this recognizes the strength of social, economic, political, and environmental influences on health. So described as a multidimensional process involving the well-being of a whole person and environment, and also health implies a sound mind in a sound body, in a sound family, in a sound environment. That is holistic. So sound mind in a sound body, in a sound family, also it should be in a sound environment. That is health. So the main emphasis will be at the promotion and protection of the health. So these are the various concepts of health. So if you are going to be asked the question as what are the changing concepts of health, Abhina, first you have to start with the definition of health, which is given by the WHO in the year 1948, and then to the biomedical concept, ecological concept, psychosocial concept, and holistic concept. So, coming to the next aspect, that is public health, and what are the various changing concepts of public health. So, starting again with the definition of public health, which is given by another pioneer, that is Winslow, in the year 1920. Because in the future you will be reading about dental public health. Actually, the definition of dental public health will be adapted from this Winslow definition. So, what is public health definition by Winslow? Science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community efforts. So, what are the three important aspects? That is preventing disease, prolonging the life, promoting health and efficiency through organized community efforts. These are the three important points to be known in the definition of public health given by Winslow in the year 1920. Starting with before straight away going into what are the various changing concepts of public health, you have to know what is sanitary awakening. Sanitary awakening, it took place in England in the mid 19th century. Then it was spread to the various other countries also. But what happens is that what are the various problems due to which there is health conditions is deteriorating in England. So maybe the slums, overcrowding, accumulation of the filth, high sickness and death rate, and also the especially among the women and children and the infectious diseases, tuberculosis and cholera. So, the Great Cholera Epidemic in 1832, the investigation was started by Edwin Chadwick, who is a lawyer in England, to investigate the health of the inhabitants. So, this cholera is a major disease which leads to the public health and the sanitary awakening, which leads to the father of public health, who is none other than John Snow. John Snow is the English epidemiologist who studied the epidemiology of cholera in London from 1848 to 54 and established the role of polluted drinking water in the spread of cholera. So, actually, John Snow, he was the person who identified that the water, the polluted water, is the reason for the cholera outbreak in England. There is a famous study, and so he is called as the father of public health or father of epidemiology. So, John Snow is called as father of epidemiology because he investigated cholera outbreak in England. So, this is the reason. இல்ல அதோட ஈஸி சார் என்ன ரீசன்னா அதாவது வெயில் வாங்கினது நைட் ஏற்பட்டவங்க தூங்கி இருந்தோம். So, what are the various changing concepts in public health? So, coming to the first one, that is disease control phase. So, what is disease control phase? From which year to which year? Is 1880 to 1920. That is disease control phase. So, it especially it constitutes with the sanitary legislations and the sanitary reforms. So, I am not control of the various physical environment. So, water supply and the sewage disposal, which are the major causes, and which should be improved. This is the main ultimatum of the disease control phase in the year from the year 1880 to 1920. So here they are not aiming at controlling of any diseases, just the human's physical environment, the ecological environment, they are going to be improved. Coming to the next one, that is health promotional phase, which is from 1920 to 1960. So there is a new concept called as health promotion began to shape at the beginning of the 20th century. Health promotion. So and also in addition to the disease control activities, what is more important is health promotion of the individuals. not only we are going to eliminate the disease, but also we have to improve the individuals uh, health by the various health services, and what are the various measures which are taken by the government in improving the health promotion of the various individuals. So it was initiated to the personal health services, school health services, industrial health services, mental health and rehabilitation services. So, so during the first of the century, two great movements were initiated. So first one is the provision of the basic health services through the medium of PSC and sub-centers, both for the rural as well as the urban areas. So basic health services is provided through primary health centers and sub-centers in the rural and urban areas. The concept of health centers was first given by Lord Dawson in England in the year 1920, similar to that of public health definition given by Winslow. So in 1920 by Lord Dawson in England, the concept of health centers, that is the like primary health centers and some sub centers. So in India, you can know the Boer Committee in 1946, it's recommended the establishment of health centers for providing the curative and preventive services. This is from first aspect of health promotional phase, and the second one is the community development programs. What is the role of a community development program? It is going to promote the village development through the active participation of the whole community, thereby improving the community health. So community development plays an important role in health promotional phase. So far, first one is the disease control phase, where you can see the environment like water legislation and sanitary reforms are happening in disease control phase. Next one is the health promotion phase, where you are not going to just going to control the diseases, but also improve the health of the individuals through the various health centers and the health services, also through various committees and programs, community development programs. So coming to the third one, that is social engineering phase, which is from 1960 to 1980. So with the advance of the pattern of the disease also, it's a form of a chronic diseases like obesity, cardiovascular diseases, diabetes, everything began to emerge. So the new concept which is called as the risk factors came into. So the risk factors is the word which is going to be important, and how you are going to tackle these risk factors is the one which is given in the social engineering phase. The social and behavioral aspects of the disease and health are given a new priority. So the public health moved into the preventive and rehabilitative aspects of the chronic disease and behavioral problems. So to tackle this chronic disease and behavioral problems, you have to go to a new priority, that is for the identification of the risk factors. So in order to control the health problem. So coming to the last one, that is 1981 to 2000, that is the health for all phase. So people in the developed countries like westernized countries, also the elite of the developing countries enjoy all the determinants of good health. That is, there is always there is not a dynamic equilibrium, because only the developed countries people and the elite of the developing countries like India is enjoying all the determinants of good health, that is the adequate income, nutrition, education, sanitation and safe drinking water. Whereas majority of the population who is residing in the rural population, they are not, or they are not getting the proper comprehensive healthcare or the various health programs which are provided by the government. So they should also have the good access or the ready access to the any health services of whatever the kind. So therefore, it is considered that the remaining 80%, except for the 20% who is enjoying the various health benefits given by the various measures given by the government, the remaining 80% too should have an equal claim to health care. So WHO pledged themselves as an ambitious target, which is then again got extended. By 2000, there should be attainment of level of health that will permit all people to lead a socially and economically productive life, which is at the start I gave this definition. So these are the various changing causes of health and changing causes of public health.